as we have discussed all the types of glaucomas, okay, now we will discuss different diagnostic tests and procedure for glaucoma, okay. So these diagnostic tests, we have the diagnostic test and procedure we will discuss one by one. The first one we have the tonometry. Tonometry means the measurement of intraocular pressure, okay. So when we measure the intraocular pressure, this is called tonometry. So the measurement of intraocular pressure is called tonometry with the help of a device called tonometer. This tonometer devices can be of several types, okay, but the common are applanation and Schwartz tonometers, okay. And the widely used tonometer, it is the applanation tonometer, and the procedure is called applanation tonometry. This is a diagrammatic look of the it is a applanation tonometer, but this is the Goldmann applanation tonometer. As the applanation tonometry can be of several types, okay, there are multiple devices of applanation tonometer. For example, this is Goldmann applanation tonometer. We can have portable applanation tonometer and we can have pneumotonometer, okay. So let's discuss the Goldmann applanation tonometer and how it works. This is the eye, okay, this is the eye and this is the prism. This is the prism of the Goldmann applanation tonometer. What will we do? We will flatten. With the help of this prism, we will flatten the central part of the cornea, okay. We will flatten the central part of the cornea and it will give us the measurement and estimation of intraocular pressure, okay. But this flattening can be affected by several pathologies. For example, corneal thickness. Corneal thickness can be caused by corneal edema, corneal fibrosis and other factors, okay. So when there is the corneal thickness, what will happen? We need to apply more pressure in order to flatten the cornea. So it will give us more pressure than is really present, okay, because we have now applied more pressure. While we are applying more pressure because the cornea is thick, so we have to apply more pressure to flatten the cornea, which will give us more pressure than calculated value. So the Goldmann applanation tonometry, it can be affected by corneal thickness, okay. A thick cornea will give us more pressure and thin cornea will give us less pressure, okay. Then actual pressure is present in the caused by the aqueous humor. So this was about the applanation tonometry, okay. Now we can have the pneumotonometer. In pneumotonometer we are using a pressurized air jet. So air will be applied on the cornea and this pressurized air will flatten the cornea and will give us the calculated value of the intraocular pressure. This is called pneumotonometry, okay. So we can use pneumotonometer as well. So now we can also, this applanation tonometer, these give us more perfect and accurate pressure, okay. But we can also use Schwartz tonometer. This is the Schwartz tonometer, although its pressure is not matchable with the applanation tonometer, but it can be used, okay, it can be used. Applanation Schwartz tonometer, this device has parts. For example, we have the scale, okay, this is the scale which will record the pressure. It is the scale, it is the needle, okay, and we have these are the foot plate, okay, which will be kept on the cornea, and this is the plunger and this is the weight, okay. This weight will apply pressure on the cornea and will intend the cornea. So unlike the applanation tonometry, Schwartz tonometry cause the indentation of the cornea, okay. This is the cornea, it will cause indentation of the cornea, okay. It will cause the indentation of the cornea and will give us the estimated pressure. So like the applanation tonometry, The Shayar's tonometry readings, they can also be affected by corneoscleral rigidity. Okay, so when there is more corneoscleral rigidity, we have to intend the cornea more. Okay, so it will give us more pressure than is present. Okay, so it can mistakenly give us more pressure when there is more corneoscleral rigidity, and when there is less corneoscleral rigidity, so we have to apply less pressure, and it can give us less pressure. Okay, less pressure. Okay, so when there is more corneoscleral rigidity, it can mistakenly give us more pressure. When there is less corneoscleral rigidity, means the cornea is fragile, it can give us less pressure, as we have to apply less intendation, so we can get less pressure. Okay, so corneoscleral rigidity can affect Shayar's tonometry, and corneal thickness can affect applanation tonometry. So this was about the measurement of intraocular pressure. Okay,